Hey everyone, this is Kristen. I hope you're doing well. I wanted to talk about an article that I read today in the Washington Post. The title of the article is called Primary Care Providers Urged to Ask About Anxiety During Checkups. If you haven't read the article, I'll provide a link in the description. But why I want to talk about this article, I think great conversations foster great conversations. And so I think this article is relevant to both healthcare providers and patients. So I want to continue to carry on those conversations so that we can continue to have great conversations about this kind of thing. I think that a lot of the points raised in this article are proof that we have come a long way in the healthcare field and that we can make great steps forward. Just a brief summary of this article. It is discussing a recommendation published by the U.S. Preventive Service Task Force. The recommendation was published in the journal called JAMA to address the ever-increasing mental health crisis in the United States. And the recommendation is proposing that primary care physicians screen for anxiety on a standardized basis. So that would mean that primary care physicians screen for anxiety in all patients across the board. Currently, primary care physicians can do this on a case-by-case basis. And the things that I wanted to talk about in the video were the good things that I saw in this article, the red flags that I had going off, and the things that I think are important to keep in mind. And just as a disclaimer before I get into this topic, these are not the opinions of my employer. These are only my opinions based on my experience as somebody who has gone through the diagnosis process of being diagnosed with a rare disease, and also as somebody who considered going into the healthcare profession early on in her career. So with that said, I want to talk about the great things that I saw in this article. And I think it is really good for us to keep in mind the well-being of those who may be affected by anxiety disorder. I think that it is true, like the article said, that many who have anxiety might not recognize the symptoms. They might not have the knowledge to be able to get the resources that they need to care for themselves for their mental health. And I think that screening could provide a way for those patients to have their mental health needs met earlier on in a way that is more beneficial for them. So I think that is fantastic. What I think is also great is that this article doesn't oversimplify the issue. It doesn't see these anxiety screenings as a perfect solution, and it raises some of the concerns that were brought up by physicians and by others who were a part of this discussion. And some of those concerns were that this could increase the workload for healthcare professionals and mental health professionals who are already experiencing a very heavy workload, and a lot of professionals in the fields are already experiencing burnout. So I think that is a great point that it raised. Another one is that the implementation of this recommendation could cause there to be an increase in medication as opposed to patients who seek out psychotherapy. So because this would be happening at the primary care physician level, primary care physicians are currently only equipped to prescribe medications. They're not equipped to provide psychotherapy. And so because they are able to prescribe medications, those physicians might be more likely to give a patient a medication as opposed to that patient seeking psychotherapy. And I think that could also be based on the patient preference as well. And so there's that potential. Another great point that this article raised was that anxiety disorders could be overdiagnosed in communities of color, which I think is really important to recognize. The article also acknowledged that having symptoms of anxiety doesn't necessarily mean that a person has an anxiety disorder. So I think that's an important differentiation to make, that just because a person has symptoms of anxiety doesn't mean that they have an anxiety disorder. The red flags that I had going off, I had a few because based on my experience in as a patient and as somebody who considered going into the medical field. So in my experience, it seems that anxiety disorders are overdiagnosed, especially when patients have complex medical histories and when they may have a rare disease that they don't know and that doctors don't know. I've heard quite a few stories in support groups where patients who had symptoms that physicians could identify were given referrals to psychiatrists or therapists, and then when they went to seek that help, the therapist or psychiatrist sent them back to the healthcare professional and said, no, this person doesn't have a mental health issue. They have a issue going on with their body and they need that addressed. And so I think in those cases that having standardized screening for anxiety could potentially be an extra barrier if the physician is not also aware of rare diseases or just diseases that are outside their realm. So for example, like it took me many years to get my Ehlers-Danlos diagnosis, and it's actually not considered a rare disease now, but very few doctors really understand Ehlers-Danlos. And I was, asked if I thought I had anxiety, if I had depression. I was at one point given prescriptions for Xanax and a list of referrals to therapists because I was told I was having panic attacks, which I've come to find out could be a symptom of my migraines or periodic paralysis, which is a rare disease. So I think there is already a very strong bias towards diagnosing mental health conditions in those populations where there's a complex medical history for patients or they may have a rare disease that's just really hard to recognize. The other red flag that I had going off from a healthcare provider perspective, I'm just questioning, are they okay with this? I know that some physicians go into their field not wanting to get into the mental health realm. And so because this could potentially have physicians taking on that role, I wonder if they're going to respond, how they're going to respond to this. So if you're a healthcare provider, I'd be really interested in your thoughts. So leave those in the comments below. I want to read the final paragraph in this article because I think it indicates kind of the intent behind these recommendations. The last paragraph of this article says the uptake of these new anxiety screening recommendations should provide an impetus and an opportunity for primary care clinicians to become more comfortable with diagnosing and treating anxiety disorders, which may require additional training. They wrote, anxiety disorders can be distressing and disabling, and appropriate recognition and treatment can be life-altering and in some cases life-saving for patients. And while I want to recognize that absolutely, like this could have a positive impact on people, I also want to consider the impact on providers. So if primary care physicians are going to be taking on this additional responsibility of having anxiety screenings for every patient, are there going to be other responsibilities that are taken off of their plate so that they can have a more balanced workload? The other thought that I had was, is there an opportunity to bring in kind of an intermediary professional, maybe somebody, I know that there's like physician assistants already and nurse practitioners. So I don't know if this is something maybe that would fall in their realm, or if it would be appropriate to maybe bring in a mental health professional or maybe even somebody specialized in identifying rare diseases into that initial appointment for maybe patients that have more complex cases. So I'm wondering, is there a way for us to help doctors and patients recognize these more complex cases and rare diseases earlier on so that they can get their care earlier and have a better quality of life and not be pushed through to therapy and then coming back to the healthcare practitioners, and everybody getting really frustrated, So those were my thoughts there about the red flags. Let me know if you have red flags going off about this. The things that I think that are really important to keep in mind as we step forward, just for my own perspective, are as patients, I think it's really important to recognize if we're having anxiety, where that anxiety is coming from. I had doctors asking if I thought I was anxious or if I thought I was depressed, and the response that I would give was, I'm having anxiety because I'm having all of these symptoms that are affecting my day-to-day life, and my healthcare team and I have not been able to identify why I'm having these symptoms or a way to manage them. And so that was anxiety inducing for me. And so that's how I came to express it. And I think that was helpful to a certain degree. So I think it's important that if we have this recommendation to standardize anxiety screenings, that we're recognizing the source of the anxiety before patients are sent to a therapist or to a psychiatrist. Because if it's something that's due to the healthcare system being so broken, then I think that needs to be addressed, and that it's going to help decrease the patient's anxiety by getting them the care that they need to address their symptoms. So that's my thought there. The other thought that I had is that I think that if we're increasing our awareness of mental health, which I think is great, I think we do need to have that. I think we also equally need to be increasing our awareness of rare disease. And I have seen that this is happening in the rare disease community, and I think it's fantastic that word is getting out about rare disease. There's Rare Disease Days, so I think that we are increasing awareness of rare disease. But I don't see it happening so much at the practical level, at the primary care level. And I think that that's reasonable. I think that doctors can't know it all. But I think that the more that we raise awareness about rare disease, then there's more potential for people to have their conditions addressed earlier on and to have a better quality of life. And so those are my thoughts there. I would be very interested in your thoughts. And what are the positives that you see in this article? What are the red flags that you have coming up? And if you're a patient or a physician or anybody in the healthcare field, what are the possible ideas that you have or solutions that you see as potentially working if anxiety screenings were to be implemented? So I'm really interested in your thoughts. If you found this video interesting, helpful, or relevant, please like or subscribe if you want to see more videos like this. Thank you for listening, and I will see you guys soon.